My name is Paul Steinwald. I'm a double board certified plastic surgeon practicing at the Center for Cosmetic Surgery here in the Denver, Colorado area. We basically perform the whole gamut of plastic surgery procedures with respect to cosmetic surgery, principally involving mommy makeovers and facial rejuvenation, but I also have several areas of subspecialization. One of my areas of subspecialization is FTM top surgery or chest masculinization. I believe we've developed one of the safest and most effective techniques with respect to keeping the nipple attached and therefore having the most natural healing and retaining a fair degree of nipple sensation. People fly in to see us from all over the country to have this highly specialized procedure performed. This top surgery is performed at our fully accredited outpatient surgery center with a very supportive staff. Patients generally will arrange for a phone or Skype consult and we'll have a full discussion. And if they are moving forward, they would fly in a day early to meet with nurses and finish paperwork and photography, etc. Oftentimes they'll have a chance to meet me the day before the surgery to finalize plans. The next day I will meet the patient while they're still awake, and sitting up we will complete markings so they have the best idea possible of the types of changes we're trying to accomplish. We are able to customize the procedure to a degree with respect to nipple size, shape, position, and degree of flattening. This technique is very versatile in terms of treating patients who also wish to be gender neutral and therefore not quite as flat. It's also excellent for handling asymmetries in general and virtually any starting point to reach the same relative and symmetric endpoint. Basically, patients who are in anywhere from an A to a C cup can be treated as a single-step procedure that takes 2 to 2.5 hours. Patients with fuller chests generally require a bit more effort and time in the OR, as well as potential for adjuvant liposuction to the underarms, for instance. In cases where patients are very full-chested, we will often utilize free nipple grafting to flatten the chest as best possible and prevent a bunching up effect. I do believe that we are able to perform nipple grafting as well as any facility in the country in terms of positioning and getting them to heal as naturally as possible. Another newer technique we're utilizing more often is a quote buttonhole technique, where the nipple is brought out through a separate hole and therefore the effect is a true double incision with a transverse incision at the fold and a separate clean incision around the nipple in the absence of a vertical scar. It's truly a great honor and privilege, as well as pleasure, to help patients with their gender affirmation surgeries. What began as a special request with my first transgender patient has grown year by year into a very fulfilling and life-affirming endeavor, both for the patients as well as myself. I do believe patients are very well treated here and feel very comfortable with this environment that we have created for them. We do take care of a lot of out-of-town patients. Again, we ask them to come in a day early and usually have them stay at least 7 to 10 days afterwards to make sure that tissues are healing well and to manage drains, which are necessary. And most people experience 3 to 5 days of discomfort requiring narcotics, but otherwise they're moving on quickly to ibuprofen and are quite comfortable. Patients can take down the dressings at 2 days and shower, and thereafter rewrap with a 6-inch ace wrap, if not wear a special compression vest. Generally, this vest is necessary for about 2 weeks postoperatively around the clock, and then should be worn 2 more weeks when active. In terms of longer-term follow-up, that can easily be achieved both with phone conversations as well as photos sent in online, but of course even better is to see the patient in person when we do encourage their return, and also I like to follow them for at least a year postoperatively.